Today's medical-centric topic is nasogastric feeding, everything you need to know. Nasogastric, NG, feeding is a method of providing nutrition, fluids, and medication through a tube inserted via the nose into the stomach. It's commonly used when someone can't eat or swallow safely but still has a functioning digestive system. Whether temporary or part of ongoing care, NG feeding can be essential for recovery and maintaining health. 1. What is nasogastric feeding? NG feeding involves inserting a thin, flexible tube through the nose, down the esophagus, and into the stomach. This tube allows for direct delivery of nutritional formulas, fluids, medications. It bypasses the mouth and throat but uses the stomach as normal. 2. Who needs NG feeding? NG feeding is typically used for people with swallowing disorders, that is, after a stroke, patients recovering from surgery or trauma, those with severe illness or unconsciousness, individuals needing short-term nutritional support. It's often a temporary solution, though some may need it for longer durations under medical supervision. 3. How is the tube inserted? Usually done by a nurse or trained provider. Lubricated tube is gently inserted into one nostril and guided down into the stomach. Placement is confirmed by aspirating stomach contents, pH testing, or X-ray. The procedure may be uncomfortable, but is quick and generally safe. 4. What gets delivered through the tube? Liquid nutritional formulas, rich in calories, protein, vitamins, and minerals. Hydration fluids. Crushed or liquid medications, as prescribed. Feeding can be continuous via a pump or given in scheduled bolus doses using a syringe. 5. Benefits of NG feeding. Non-surgical, fast to start. Helps prevent malnutrition and dehydration. Supports healing and energy needs. Can be used at home with proper training. 6. Risks and side effects. Nasal or throat irritation. Gagging or discomfort, especially during placement. Risk of tube displacement or blockage. Rarely, aspiration, food entering lungs, or infection. Proper care and regular monitoring reduce those risks significantly. 7. Caring for an NG tube at home. Flush the tube with sterile water regularly to prevent clogs. Keep the nose and skin clean to avoid irritation. Watch for signs of infection, tube movement, or feeding intolerance, that is, bloating, nausea. Nasogastric feeding is a safe, effective way to provide nutrition when eating isn't possible. Though it may seem intimidating at first, it's a life-saving support system that can be managed at home with training and proper care. Always follow your healthcare team's guidance for the best outcomes.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.